The past year has been one of the most difficult and challenging years in any, if not all, of our lives. The number of lives lost, the isolation, the economic impact, the effect on childhood development have been devastating. Those of us in healthcare have seen much of this devastation firsthand as we care for those impacted by COVID-19. And that is why we are asking you to get vaccinated. For the safety of yourself and others, and as the only way we as a community can safely get back to normal.
There's a lot of information out there about the safety and efficacy of COVID-19 vaccines. Not all of it is correct, and much of it can be confusing. We at mrpG understand that some of you may be overwhelmed by the information and unsure if you should get vaccinated. We recognize that most of you trust your doctors and typically turn to them for answers regarding these important decisions. So we thought we'd take this opportunity to have some of our outstanding physicians tell you in their own words why it's important to get the COVID-19 vaccine.
The actual technology itself has been around for decades. This is not new. It's important to note that the clinical trials that have been done with all these vaccines have been on roughly 40, 50, 60,000 people, and they were deemed very safe.
The vaccines have been 95% effective in preventing infection and hospitalization. They have been 100% effective in preventing death.
The vaccines are safe and effective for adolescents and adults of all ages, races, and ethnicities. Vaccination is especially important for patients with chronic medical conditions.
We were able to develop these vaccines so quickly for a number of reasons. One, our technology has increased tremendously, over the last decade or two. So that's one reason we were able to develop these vaccines very quickly. Two, there were literally hundreds of research labs throughout the world working on this problem. We're in the middle of a pandemic, so recruiting patients was unfortunately not that difficult, and that's why they were able to enroll so many patients so quickly and be able to get the data out there soon.
We know that COVID-19 can cause serious life-threatening complications. I've seen it firsthand. But what we don't know is how it could affect you or your loved ones. Getting the vaccine is your best defense.
COVID-19 is easily spread. Even people with mild or no symptoms can spread the illness to family, friends, and others around them. Getting vaccinated is the best way to protect you and your loved ones.
Remember, it's not just about protecting yourself, it's about protecting others. While you may be young and healthy and may not really get too sick from COVID-19 if you happen to contract it, you have to remember there are other people in our society that may not be as healthy as you, who may have impaired immune system for some reason, and those are the people that can really get sick and be affected by COVID-19.
According to the CDC, there is no evidence that COVID-19 vaccines cause fertility problems. In addition, the American College of Obstetricians Gynecologists back the vaccine's safety in both pregnant women, lactating women, and those planning a pregnancy.
None of the vaccines authorized for COVID-19 contain the live virus that causes COVID-19.
Fully vaccinated people can finally be around unmasked with other fully vaccinated people. We can see each other's faces and enjoy our smiles again. It's time to enjoy those milestones in life that we've missed. Weddings, graduations, birthdays, new children, all the celebrations that are so meaningful for life.
Vaccination has turned the tide on COVID-19 with the lowest hospitalization and death rates that we have seen in more than a year. We are so close to getting back to normal life.
Call your primary care physician if you have concerns about getting your COVID-19 vaccine. We want to do everything possible to take the best care of you and your families, and most importantly, beat this virus so we can all get back to enjoying our normal lives. Thank you for listening.